So, hello and welcome to today's conversation, which is produced in partnership with NextGen Healthcare. And I'm delighted to be joined by Jenna Hagan. Ambulatory healthcare is under enormous pressure right now. Provider organizations are being asked to do more with less, manage rising operational and financial complexity, improve patient experience, keep clinicians engaged at the same time, make sense of a fast moving technological landscape, especially when it comes to AI. What makes this conversation so timely is that AI in healthcare is no longer just a future facing idea. It's becoming part of everyday workflows, clinical documentation, revenue cycle, patient engagement, analytics, and operational decision making. But with that comes a bigger question. How do organizations move beyond pilots, point solutions, and hype and towards technology that is genuinely embedded, trusted, and useful in the day to day running of care? Jenna brings a really practical perspective on that. Her work sits at the intersection of ambulatory operations, product strategy, patient experience, financial performance, and the responsible application of AI. So today we're going to talk about the pressure facing ambulatory organizations. What is consolidation is changing, where AI is actually delivering value, and what the next 3 years to 5 years could look like for organizations trying to transform without disrupting the care they deliver every day. Jenna, welcome to the show.
Thanks for having me. Excited to be here.
Awesome. So the healthcare right now, the healthcare industry right now is going through a huge amount of change, operationally, financially, and technologically. From your perspective, what are the biggest pressures ambulatory organizations are facing today?
Yeah, it's a great question. And I think we're in probably one of our biggest or largest shift since going to the EHR from paper charts, right? But the pressures, they're coming from every direction simultaneously. So financially, operationally, organizations, they're dealing with margin compression, labor costs, reimbursement pressures, increasing administration complexity. Operationally, staffing shortages remain very significant. They're costly, the training, the onboarding, the offboarding time, particularly in the front office, clinical support, and revenue cycle teams. But at the same time, patient experience expectations, they continue to rise. We're consumers in the healthcare industry. We have modern expectations. We want easy access. We want the ability to do it at any time of the day, 24/7, and we want the ability to prepare for our appointment so we're not having to have those paper and clipboards when we show up to our appointment. Um, Technologically, organizations, they're trying to modernize, but they're also still trying to operate on workflows and do that in parallel. And it's designed for a very different era of healthcare that they're not there yet in a lot of ways. But what's unique today is that these challenges are no longer isolated. Workforce shortages create operational inefficiencies. Inefficiencies impact financial performance. Financial pressure limits investment capacity. And so leaders are looking for those ways to improve productivity, but without simply just adding headcount. And that's why AI has become such an important conversation for these organizations. They're not just looking for technology for a tech's sake, they're looking for it to leverage and create those operational efficiencies and workflows.
Absolutely. So no longer it's a technological constraint, it's more about a capacity constraint of organizations being able to roll in and bring all of those advancements within their operating models. Beyond that, we're also seeing an increasing consolidation across the ambulatory space, especially with private equity-backed growth and MSO expansion. How is that changing what providers expect from their technology partners?
Yeah, it's a great question. I mean, scale changes everything. When organizations grow through acquisition, through private equity investment, MSO expansion, they inherit complexity. They're often end up managing multiple workflows, multiple systems, different operational models, broken models. And so historically, providers, they're evaluating technology based on individual needs or features or their organization's needs. But today, they're increasingly evaluating technology based on its ability to standardize operations, give the best practice out the gate, but most importantly, be able to scale and drive that, global performance across whether it's specialty markets, whether it's across state lines, whether it's moving from a hospital to an ambulatory workflow or even ambulatory to hospital system. Um, the conversation really has shifted from can your system do this feature function related to can your platform help us scale.
Mhm. Absolutely. And AI has obviously become a big part of that conversation and one of the defining conversations in healthcare technology today. But there is a lot of noise in the market as well. From your perspective, where are we today in the AI adoption journey?
Yeah, it's a great question. I really think that we're moving from that experimental phase to that authorization phase, or the proven, the outcome phase. Over the past few years, organizations they've been evaluating AI. They're using pilots or isolated point solutions or use cases, and they say, look, as a provider, I'm sick of staying here till 9 p.m. finishing my chart records. I know when I ran an organization before working for NextGen, that's what we did. We waited in the office and went through the charts that were stacked up on the desk, and we had those cues of, remember, they were wearing the blue shirt and their son played lacrosse, and we knew how to finish the chart from there. And so they're like, well, how can I solve that? So I'm going to pick this one clinical AI solution that'll fix my documentation time. But it's different now. They're learning how to operationalize it and scale that to their support staff. And how does that help my billing? How does that help my coding? How does that help my billing team get better claims out the door and make my payers happier? It's focusing away from novelty and towards productivity and workflow, I think, and platform embedded are kind of those key words where it's driving that business impact. And we're really beginning to see organizations move from that AI demonstration towards enterprise AI strategy.
Absolutely. And one of the things I wanted to double click on, I know we've spoken about it previously before, talking about sort of embedding the AI within the system. There is a difference, right, between embedding the AI as well as truly native or the orchestrated AI. Could you unpack that a little bit in terms of the distinction between the two?
Yeah, absolutely. Many current AI deployments are essentially embedded features, right? If we talk about clinical AI, like it's in the workflow, you don't have to copy and paste it. It's an embedded feature. They perform that specific task, they generate a note, they summarize a chart, they draft a response, but they're largely still operating in isolation. Those capabilities absolutely provide value, but it's a percentage of value,
Mhm.
and they're disconnected from the broader workflow. And there's a big conversation and a lot out there around, system of record to system of context. And really what that means is helping to take the information. EHRs today are records, right? They store, they record, we hold on to the information. But today, staff members, they have to say, okay, I'm going to go treat this patient. What medication was prescribed? What other care have they been diagnosed with? What did I do on my last assessment and plan? And then they have to have that cognitive burden to connect it, contextualize it, and know what to do next. And in the world of orchestrating or embedding AI and getting that true layer, the system knows the data that's there. It knows where it came from. It knows where you likely are going to put it based on other past trends and workflows in the technology. So taking true orchestrated native AI embedded into a layer of a platform allows for you to help that cognitive load and burden to take it all, contextualize it together through technology, through automation, surface it up to the user, saving clicks, saving time, saving cognitive load. And not only just saying, here you go, but saying, here's what you did, here's what we recommend you might need to do today, like they're overdue for an A1C, and here's where we recommend you go do that. And that system of context to me is really important to actually drive into action, system of action. It's one thing to surface the information, it's another thing to drive into workflow and help the support staff and the users and the providers and the financial teams get to where they need to go. And that's absolutely where healthcare has been heading, but where you're really seeing that big shift of embedded versus orchestrated AI.
Right. And that kind of reminds me of the conversation we've been having sort of as an industry for the last 5 to 10 years in relation to the difference between the point solution and the platform play. And a lot of the comments you've just made resemble that we're having AI point solutions in healthcare, right? And we're slowly beginning to move towards a different model. Do you think, in reality, in practical terms, the market is already actually starting to move beyond that point solution AI model?
I do, absolutely. And you're seeing, more scaled outcomes, more scaled success. And that means that the technology is connecting and contextualizing. Many current deployments, we're still missing the context, the workflow context, but you're starting to see that improve. But you're also still seeing depends on kind of the vendor strategy and whether they're truly a platform that can scale to very specific or broad markets and specialties, you're still seeing a difference of strategy in whether are you layering AI and embedding it, or are you orchestrating and intelligently connecting the record that you know and well. And there's a difference there that organizations need to realize. And there's some true consideration as well as the technology and as a client using it that they need to understand.
Absolutely. And obviously, NextGen yourself, guys, you've gone through a major transformation over the past few years. How has the platform evolved to support this new generation of AI-driven works we've been speaking about?
Yeah, it's a great question. NextGen specifically has really over the last several years been focused on, one may call it modernizing the platform, the architecture, but we knew where the industry was going. We were one of the first to get clinical AI out to the market over 3.5 years ago. We've learned a lot from that, and that embedded workflow and use cases is really scaled to support multiple scenarios and starting to drive into that context in the technology. But we've been building towards a platform where AI is not layered on top or even within in specific use cases. It becomes a natural extension of how work gets done. And it becomes a natural extension of a platform working with a user and not forcing a user into certain areas. While AI adoption has scaled, 68% of organizations claim or report that they're using two or more AI models in their workflows today, and that's up from 39% last year per MGMA and HFMA and some other organizations. And that's huge adoption, right? But there's still this hype versus reality. There's still this fear for providers of, is it going to force me how to practice and change how I practice? And there's a paradigm shift of what NextGen has done to evolve the workflows and our technology and our platform to really help ease that and overcome those barriers to work with you. Let
Mhm.
you be the trusted advisor of the care, the provider, the support staff, and let the technology work with you to make things easier and not make you have to go hunt and peck and find and click and all those different, pain points that organizations experience.
100%. And it kind of echoes back on the capacity constraints we were talking about in the beginning of the conversation in relation to sort of technological speed and innovation is moving at such a fast pace. How can constrained ambulatory practices keep up with that? And so, within that scope, healthcare organizations often struggle with the change management and the technology transitions. How do you guys balance innovation speed with the reality that providers can't completely disrupt the operations overnight?
Yeah, it's a great question. I mean, healthcare is not an industry where you can just simply rip and replace, right? I mean, it's 2026 and fax and e-fax still exist and you still see paper and clipboard. So
Right.
it's not a rip and replace as much as we would like it to be, but patients still or providers still need to see patients tomorrow morning. Like healthcare doesn't stop either. And so our philosophy is we're maximizing today's investments, we're building towards tomorrow's capabilities. Organizations need a path that allows them to improve productivity and efficiency, incrementally innovate and follow that journey. But, speed today in healthcare tech is very different than what speed was even a year ago. AI has helped even development and technology, let alone users in the technology world. Um, I also think that there is an important distinction between an evolution of speed to impact and speed to operational reality and doing it right. Like there is a very important need to make sure that how you scale a platform and how you embed and natively orchestrate your data, it needs to be governed. It needs to be built on a foundation that is visible to a tool to make sure it's done responsibly, right? There's ethical considerations. You want to make sure it's non-biased. You want to make sure that it'll follow governance and regulatory pressures and that takes time. And so there's just this balance between innovation speed, which is already 10x year over year for technology, thanks to AI and coding efficiencies. But you still need to make sure that operationally you're deploying as a trusted advisor, as a vendor, technology that's done responsibly. And that's just a really important factor.
Absolutely. And sort of beyond the responsible usage of AI, it's also becoming a huge differentiator for vendors within the space, right? If you can provide AI that is responsible, is governed, it's protected with guardrails, all of a sudden you're going to have a lot more trust and buy-in from the clinicians already. Have you guys seen that to be a differentiator in the healthcare industry already?
Absolutely. I mean, just kind of like I mentioned, a little bit of AI, it's accelerating software development, right? It's changed innovation. It's unquestionably accelerating. The amount of time that it takes to build code now versus even 6 months ago is just exponential.
Mhm.
It creates tremendous opportunities for healthcare technology companies to bring new capabilities to market more rapidly. But again, there's a balance, right? Healthcare still remains different than a lot of industries. While development cycles are speeding up, adoption cycles still require trust. They require governance. They require validation, but more importantly, an ROI, proven outcomes, proven impact. And one thing that has really remained in healthcare for a really long time, but is really at the forefront right now is change management. Operationally changing and training and getting into these new workflows. AI is helping it. It's a little easier because it's an easier UX, UI to experience and leverage, but it's still different and you still have to change manage. I mean, how many times do we all day to day do something and we realize at some point, why am I doing it this way? Why am I in an Excel spreadsheet? I can do it so much faster. I can build an agent or a chat GPT to help me.
Right.
And it just takes that pivotal moment to change manage us. And so imagine an industry, a platform, an organization trying to adopt and transform incrementally as well.
Absolutely. And sort of within that space, there is currently no unified regulatory framework for the AI in the US healthcare. How should organizations, providers think about evaluating AI vendors or AI adjacent vendors within this environment?
Yeah, I mean, healthcare decisions impact people directly as an organization, as a provider, as a payer, as a technology vendor, and it's not just about productivity software anymore. I mean, we've always had regulatory standards to follow as a technology vendor, but there needs to be transparency, there needs to be accountability, security, privacy, clinical oversight, and we've always known that as a technology vendor, and it's still a little unclear right now in terms of what it'll look like for AI, but we all know it's coming. And different states are ahead of it, and different states have a little bit higher pressures in, assembly bills and regulations that they're pushing down, but it's not universal. It's not across everything yet. And so, as a vendor and as an organization, you need to be educated, but you need to know that you're partnering with a trusted platform, a trusted advisor that acknowledges that
Mhm.
and is building it already responsibly from the foundation up so that you're SOC reporting, your pen test, all the things can be produced, and you know that you're using secure, scalable, governed platforms with AI that's also following the regulatory standards.
Absolutely. And now let's shift the conversation slightly towards a more practical angle. In your experience so far, what are you seeing to be the most meaningful AI-driven outcomes today across sort of the whole ambulatory healthcare landscape?
Yeah, it's a good question. I mean, time productivity is always is one of them, right? Like shorter time to document. We have so much visibility in a platform to be able to see clicks, right? Or workflows and where staff members go to do what and how long they spend on that. And so we can quite literally see patient arriving to patient leaving and how long it takes to do each function. And we've seen a huge shift from not just like a check-in experience, but also a decrease in time to document their entire record once they get back to the exam room, almost 12 minutes per visit on average. And when you add that up at 30 to 60 patients a day based on your specialty, that's not just incremental outcomes. I mean, that's tangible, areas to where you can use it to either spend more time with your patient or add more patients. Because there's an interesting conversation there too, right? You've got some organizations where it's, I want to see more patients in a day. So, what's their goal to make sure we have the right outcome? Or it's, I don't need to see more a day. I just want to see them better, more detailed, more meaningful. And the technology can do either.
Mhm.
You're also seeing higher reimbursability because you're getting more detailed documentation that is allowing you to charge more or bill more for the leveling and the detail of your visits because unless you spend that full hour and a half documenting everything in those detailed narratives for those high level codes, you're not going to get reimbursed for that. And so the ability to actually have technology help you document for the time that you have been spending with those patients in those detailed visits is also a huge outcome.
Mhm.
We're also seeing denial rates decrease as well as kind of the last third big bucket. We know what payers need and require. We know how to bill or not to bill, but you're always going to battle the payers and even kind of the battle of the bots. They're using AI just like we're using AI. But you're seeing a big decrease in denial rates as well based on technology working through the workflows.
Absolutely. So we've touched base upon the clinical documentation that's solving the issues with sort of the efficiency and the quality of the note, which also has downstream implications on the revenue cycle part of the operations. There is also an element of sort of the operational AI and analytics acceleration as well. How
Yeah.
important is faster decision making becoming for healthcare organizations today?
It's critical. I mean, healthcare leaders are managing increasingly dynamic and aggressive environments, demanding environments. They're waiting weeks for reports that are no longer sufficient, right? Unless you're a data scientist that has full access to your data dictionary that knows exactly how to pivot and write the KPI and analyze it, you're waiting a long time for that report. The time to insight, the TTI,
Mhm.
is decreasing over 65% because of AI. It already has that. It already knows how to contextualize it and pull it together and build these KPIs together. Organizations need that near time, real time visibility operationally, financially, and clinical. And AI can transform those analytics from retrospective reporting into proactive decision reports, much like no-show predictability. I mean, the data's there, but unless you know how to go find it and how to read it and how to analyze it over the past 3 decades, that's been the hard part. And so now the data can say, hey, this region of patients is your highest percentage of no-shows. You should open a location there, or you should open times to help them get to your location a little better. That can help your no-shows. So speed to insight increasingly determines your speed to action.
Fantastic. That's very interesting. And looking over the next few years, 3 to 5, let's say, what do you think will define the organizations that succeed in ambulatory healthcare transformation?
Yeah, I think adopting is starting point, right? I mean, if you're an organization that is hesitating to adopt, you're going to be behind. And it's not just from a technology standpoint, it's your competitors as a healthcare organization. In the ambulatory space, you're not the only cardiologist or gastro or urologist in your area. And your patients are looking for a practice that can get them in that day, that can answer the questions they need, that gives them that secure access digitally. And if you're not providing that, and if you're not leveraging the technology to give you that scale and that access, you're going to get behind from your competitors because your patients need it, right? And so successful organizations over the next 3 to 5 years, you've got to start now in adopting and scaling, but you've also, it's not about having the most technology, it's the ability to translate what you adopt into your outcomes and figure out what am I trying to solve? What can it connect operationally across the most areas? And not just be a point solve use case, but how many people can I help in my team that then translates to the patients?
Fantastic. So essentially, focus on the use cases that actually bring a difference. Don't integrate technology just for the sake of it, and make sure that there is a downstream impact as well, not just on the clinician or a physician or a practitioner utilizing the say application, but also on the other members of the healthcare organization.
You got
Well,
it. Yep.
thank you so much, Jenna. This has been really, really insightful and interesting conversation. I really enjoyed it. And if you'd like to learn more about NextGen and the solutions they provide, feel free to check out NextGen and their website. The link is going to be in the description below. And similarly, Signify Research is a health tech, medtech focused market intelligence firm. If you have any questions or queries or would like to discuss market trends, feel free to reach out. Thank you so much for the time today.
Thanks for having me.
Cheers. Bye.
Bye bye.